Greetings everyone. This month we are discussing about Dr. Seshagiri Mallampati, the famous Indian anesthesiologist from the Telugu states, known for his eponymous Mallampati classification or score. Dr. Mallampati was born in 1941 in Pachalla Andhra Pradesh, into a family of seven to Veeraya and Anasuyamma. Dr. Mallampati's journey in medicine began in 1968 when he graduated from Andhra Medical College. Later, he emigrated to the United States in 1971 and completed his residency and fellowship at Harvard Medical School. He served as an attending anesthesiologist at the Brigham and Women's Hospital, later became an attending assistant professor at the Harvard Medical College. Dr. Mallampati retired from his medical practice in 2017. Dr. Mallampati's most enduring contribution emerged from a moment of clinical challenge in 1975. During what was expected to be a routine caesarean section, Dr. Mallampati encountered a patient who proved unexpectedly difficult to intubate. Although both the mother and baby remained safe, the episode left a deep impression on him. He observed that the patient's tongue was disproportionately large, obscuring the view of the airway despite her neck appearing normal. He hypothesized that the size of the tongue was a significant factor in predicting difficult laryngoscopy. He further went on to explain that if the base of the tongue is disproportionately large relative to the capacity of the oropharynx, it would obscure the view of the facial pillars, posterior part of the uvula, and eventually the soft palate in that order. It would also render the angle of the trachea more acute and obscure the larynx. This hypothesis was published as a letter in the Canadian Anesthetist Society of Journal describing a difficult intubation in a female patient whose mouth could open widely but whose tongue obstructed the view of the facial pillar and the uvula. In 1985, alongside his colleagues, Dr. Mallampati published a study in the same journal that involved 210 patients about the correlation between decreased visualization of the soft palate, facial pillars, and uvula, and their association with the difficulty of intubation, a landmark study in the same journal. The study divided the patients into three classes, the Mallampati classification. It showed a correlation between the Mallampati classification and the difficulty of intubation. Later, two British doctors, Dr. Samson and Dr. Young, published a revision in the Journal of Anesthesia adding a fourth class to the Mallampati classification and has named it the Modified Mallampati Score. Till date, the four-class Mallampati score remained the standard. The Mallampati score has become one of the most widely used bedside tools in anesthesia to help predict the ease of endotracheal intubation. It was best used as a part of a composite airway assessment along with the thyromental distance, mouth opening, neck mobility, upper lip bite test, and so on. The higher scores of Mallampati class also correlate with the increased risk of obstructive sleep apnea. This simple, no equipment visual test has saved countless lives by alerting the anesthetist to prepare for alternative airway plans when a class 3 or class 4 Mallampati is found. Even decades later, every time we say a Mallampati 3 in the OR, we honor Dr. Mallampati's elegant contribution to patient safety. His legacy lives on in every airway evaluation we perform and in every safe intubation we achieve. The next prominent personality that we are about to discuss in this session is Miss Alice Magaw. Miss Alice Magaw is a pioneering nurse anesthetist. She performed over 14,000 procedures with no fatalities and is fondly called the mother of anesthesia. Miss Alice Magaw was born on 9th November 1860 to Thomas and Nancy Magaw in Ohio. She attended the Women's Hospital School of Nursing in Chicago, Illinois between 1887 to 1889. She met and befriended Edith Graham, who later became her classmate in the Nursing School of Chicago Hospital for Women and Children. It is this Edith Graham who introduced her to anesthesia. After graduating, Miss Magaw started working as a private duty nurse in Chicago. After 4 years, she became the anesthetist nurse for Dr. William J. Mayo and Charles H. Mayo at St. Mary's Hospital in Rochester until 1908. The most common anesthetics at that time were nitrous oxide, chloroform, and ether. Miss Magaw strongly preferred ether, which was less pleasant but more effective than nitrous oxide and much safer than chloroform. Magaw once remarked, "Either kills slowly, giving plenty of time, but with chloroform, there is not even time to say goodbye." Although vaporizer style inhalers had been developed in 1847, they were not commonly used in the US. American surgeons generally dripped anesthetic onto a towel, gauze pad, or a conical sponge and held it firmly over the patient's nose and mouth. Magaw detested the so-called choking or smothering method, deriding it as a cone and struggle. While some providers of the time believed that hypoxia was an aid to anesthesia, Magaw insisted either should not be combined with asphyxia. Her preferred technique involved the Eschmark inhaler, a wire-framed mask covered with cloth onto which she dripped ether from a can. Instead of forcing the mask into position over nose and mouth, she slowly lowered it to the patient's face. While doing this, she spoke naturally to the patient about just how the anesthetic was expected to affect him. Magaw argued that taking in this way not only increased the patient's confidence but also aided the anesthetic process through the power of suggestion, which she called as a great aid in producing a comfortable narcosis. Once the patient was unconscious, Magaw would switch from the first ether can to a second, smaller one, which she applied to maintain anesthesia during the procedure. She would also carefully position the patient's head and jaw to avoid obstructing the airway. The open drop technique was not new, but Magaw was one of its most skilled practitioners. She refined her technique through careful research, observation, documenting the unique complications associated with different types of surgeries and different types of patients. The visiting surgeons who came to Rochester to observe the Mayo doctors perform surgery noted the skills of this nurse anesthetist and sent their nurses to learn the art of giving open drop ether. Magaw's legacy is in the delivery of 14,000 anesthetics without a single anesthesia related death. As a nurse, Magaw couldn't submit her findings directly to the medical journals, but she later received invitations to lecture before local medical societies, which gave her the opportunity to publish her work. Her first article, an 1899 piece in the Northwestern Lancet, recapped her recent lecture in the Olmsted County Medical Society. In all, she would publish 6 scholarly articles which helped her secure international recognition. The 5 articles she published between 1899 to 1906 in the medical journals detailed the technical aspects of administering open drop ether anesthesia. Her research and clinical findings set new standards of safe delivery of anesthesia in those early days. Dr. Charles Mayo bestowed upon her the name Mother of Anesthesia for her mastery of open drop ether. The American Association of Nurse Anesthesiology established the Alice Magaw Outstanding Clinical Practitioner Award in 1998. This award recognizes the accomplishments of CRNA, a certified registered nurse anesthetist involved in direct patient care who have made an important contribution to the advancement of nurse anesthesia practice. Her published articles about safe anesthetic delivery, patient assessment, and vigilance anchor her place in anesthesia history. A recently discovered anesthetic record with Magav's signature shows her documentation using patient assessment rating scores similar to that used by the nurses today. Although the specific anesthetic techniques Magav used are now obsolete, her thorough professionalism decisively established that nurses could safely and effectively administer surgical anesthesia. Her work is foundational to the modern specialty and has even cited as part of the legal basis for CRNA scope of practice. Thank you. Let us meet with another prominent personality in the next session.